I know we've been kind of talking separately about how we can help patients bring up topics they might not want to talk about, and like a forum where there's like, there's something I want to talk about. Can we just bring it up without having to say it? Because I know like sort of that there's a barrier, just like saying it.
What is it that you are embarrassed to talk about with your doctor or your nurse? Or actually, what is it that you're embarrassed to talk about with your patients? Because too often, for each party, the taboo topic is sex, which is kind of crazy since we are all animals, mammals, primates, Homo sapiens, you get what I'm saying. It is a natural, primitive thing that we do, want to do, or think about. And much of the time, our focus might not be on that spreadsheet or what your friend is actually saying, but on sex. Since sex is still so taboo amongst many, and because sexual dysfunction is so common amongst people with an epilepsy, it is a topic that we are covering at our upcoming IEC conference in Lisbon. And today we hear all talking about sex in the appointment from epileptologists Brad Kamitaki and Lucas Orellana. If you haven't done so already, please press the thumbs up for this episode, comment below and subscribe to our channel so that we can get way more people around the world, clinicians, patients and the general public, learning facts about the epilepsies.
My name's Brad Kamitaki. I'm an assistant professor of neurology at Rutgers Robert Wood Johnson Medical School in New Brunswick, New Jersey. And I see people with epilepsy, do some research, teach medical students, residents, fellows.
My name is Lucas Orellana. I'm from Buenos Aires, Argentina. I'm an adult neurologist and epileptologist as well.
Well, last week we spoke about one of the topics that people don't like to talk about in appointments, which was suicide. But this week we're talking about sex. So why is sex seen as such a challenging topic to bring up by both parties, in fact? Let's start with clinicians. Brad, why is it difficult from your perspective? Or can it be difficult?
I think it's probably the fear of expectation of how the patient might take it. I wouldn't want to, if it's something they weren't expecting, I guess, question they weren't expecting, I wouldn't want to make them feel uncomfortable or, bring up something they weren't prepared to talk about. Sometimes I notice that we have certain topics that we want to bring up that the patient may not have, expected. Sex being, could be one of them. But that's kind of my fear, I guess, my internal fear, my thoughts about it, yeah.
So it's not actually about talking, it's not doing the talking about the topic, it's about the potential reaction of the patient.
I would say so, yeah, for me.
As Brad says, probably from the point of view of the clinician, there is sometimes some worry about offending the patient, probably during the first interviews. But from the side of the patient, sometimes having that fear that what you say is a little bit embarrassing or ridiculous, or okay, so first of all, these are the common situations that usually happen, especially during the first meetings.
And then there's the looking at it from the perspective of the person with the epilepsy as well. And sometimes their family, if there's family in the room, oh my God, that just makes me want to cringe to the thought of it. But as a patient or person with an epilepsy, even I am rather open-minded and open here on this podcast. But just the thought is like, oh, by the way, I don't know if it's something from when I was little or it's a societal thing. I'm just like, yeah, but I do speak and have spoken about it, but it doesn't come easily. What are your thoughts on what it can be like for the people with the epilepsy?
Definitely if it's something on their mind, I'm sure it's great. It's good to have the space to, bring it up. So, I know we've been kind of talking separately about how we can help patients bring up topics they might not want to talk about, and things like a forum where there's like, there's something I want to talk about. Can we just bring it up without having to say it? Because I know like sort of that there's a barrier, just like saying it.
Way some cultures are grown-ups in this world. They're totally cool with it. It's a function of who they are as humans, and they're totally cool to speak about it. And I would love to grow up one day and be like that, because I think it's great. But not all of us in the world are yet like that.
Well, I think that the complexity resides on the fact that there are different cultural backgrounds, as you mentioned, languages, identities, This changes daily. So it's our work that we can adapt to the new times and to adapt to the new realities. If we work on that, and this idea of talking about this is like a big advance to probably previous decades where these topics probably were not taught, because when we talk about sex and epilepsy, we're talking about some traditionally considered secondary issue, but I don't know if that is that really as secondary as is uh, probably thought. I think that is as primary as the control of seizures.
Thank you. I think that's really powerful what you've just said. And even if, and I know I've said this a million times, things like this, but the thing is, if you look at people's quality of life, and often that's in relationships, and it can be in sexual relationships sometimes, and if that's not where you feel it should be or could be, that affects how you feel and could actually indirectly be responsible for seizures.
I was just thinking, Lucas, as you were talking, like probably people aren't used to even bringing up sex with their doctors in the first place. Like I wonder when we started. I mean, I'm sure like my parents' generation, probably it wouldn't be natural to bring it up with a doctor, or, or even anyone probably.
I think that's why lots of them drank alcohol so much, actually. Not that people of this generation don't, but yeah. Have you guys had any interesting, which might be kind of funny upon reflection, but weren't so funny at the time, events talking about sex with a patient or even a colleague?
To be honest, not. But the good thing for me is that at first, patients are sometimes a little bit shy about talking about these kind of issues. But with the pass of the time and the interviews and having a more confident space, probably they throw the subject spontaneously, and I think that this is great, because this is our aim to make a to safe space, sorry, to for people with epilepsy to talk about these and other considered taboo subjects. But particularly, I didn't have any particular, or I don't remember that.
We're talking about yet. I'm sure you will at some point, so get ready. What about you, Brad? Have you had any experiences in this realm yet?
Yeah, definitely more of the patients I've known longer. I think, as you said, Lucas, like perhaps it's not the first visit, but, the fourth, fifth, even few years seeing them. So yeah, definitely patients have brought it up. I have to admit, I need to ask about it more. Maybe I'll have more stories in that case. But I was just thinking, remembering as I was listening to your last video about sex and epilepsy, how lamotrigine might increase sexual desire. And I've had actually a patient say the opposite, So I think whereas another patient said clobazam, which you might think might put them to sleep or, not put them out of the mood. Actually, another patient said that increased his sexual sort of drive. Yeah. So it's so interesting. I think it's hard to say, everyone's so different. And of course, we know that in how people respond to medications, their side effects. So I think, yeah, keeping an open mind, of course, keeping your clinic a non-judgment zone, does lead to some interesting conversations that I wasn't really trained for, I would say. I've had patients ask for, Viagra, erectile dysfunction medications. So, I mean, something I did learn about and tried to prescribe if I'm able to, if they don't have a primary care physician, for example. So yeah, I mean, it's been constantly it's a learning process, and yeah, there's definitely questions that come up that always surprise me, I guess you could say.
But I guess you'd welcome them anyway, right? Just because they surprise you doesn't make them bad questions.
Mm-hmm, definitely. And if I have to look it up, I think, or ask someone hey, for example, a family medicine colleague, what do you do in this situation? Yeah. Learning is always good.
When it comes to diversity of patients and families, because we all come from different backgrounds, religions, cultures, etc., in your experiences, have you found that has impacted your ability to talk to them about sex, or for them to talk to you about it? Or do we need a study on that? Or I don't know.
Yes, totally. It's always a challenge, but well, as we mentioned before, it's all about adaptation. Adapt ourselves to these situations that not only happens in the field of epilepsy, but in medicine in general. So I think that if we work on that, I think that everything has its time. So for me, at least, I prefer that patients and families pace the time. Okay, so not all the subjects, such as sex, are going to be discussed probably during the first
Right.
meetings. This, or probably in some cases, yes, and that would be depending on, as we mentioned, culture and the history behind that patient and that family and the previous members of that family, fears, personal experiences. So I think that everything should be taken in account.
Open-mindedness, I think, is a key thing here.
Yeah, I mean, this is something like that's, I think, also evolving in medical education too. I mean, when I was a student, which I mean was like 2008, so not that long ago when I started medical school, there was this like movement towards cultural competence where it's like you should know about every culture and try to anticipate. Like, I mean, it can come up with very stereotype sort of things that, kind of get in there. And now we've moved towards basically kind of a different approach where, yeah, we're curious. We can't know everything about everyone's culture, but being curious, like, everything we're saying, asking those questions, asking permission to talk about subjects, which I think is, something, an approach that you can take. Really we're moving towards that direction. And with sex as well, like when I was a student, I learned this, like, ask every patient or ask your patients in clinic, do you have sex with men, women, or both? As like the sexual question, like, sexual history screening question. And obviously there's like a lot more than just that,
There
who
are
your
other
partners
choices,
are.
right?
Yeah. Right. Definitely now, yes, not just the gender binary, of course, but also like, sexual practices. So there's much more in the sexual history, I guess, that we're trying to teach our students that I certainly learned, which, again, wasn't even that long ago.
It's so good. I think we're getting better and more open-minded, and I think that's what we need. So we are going to be talking about sex in Lisbon. I'm not sure if we'll literally be talking about sex on a stage, but we're certainly going to have an audience there. And sex is one of our topics. So we're going to be presenting about the awkward topics that nobody wants to bring up, or lots of people don't want to bring up in a consultation, whether they be a clinician or be the patient or be the family. And so it's great that we're doing it all together, myself as a patient and you guys as the clinicians, and we role play as well. Tell us about the role play. What's going to happen?
Well, there's going to be a really interactive, theatrical way to make this session more fun, more funny, and it's going to be good.
It's going to be really interactive sessions. So hopefully, if you come, come ready to talk and discuss. And we're also having some audience role play. I mean, in small groups where, you can try to think about approaching difficult topics, whether as a patient, clinician, so a lot of fun activities, I would say. Yeah.
Thank you so much to Brad and Lucas for such a fun, candid chat. Come and meet us at the International Epilepsy Congress in Lisbon with our colleagues Milena Gandhi and Heidi Munger-Clary, who were from the podcast last week, at 8 a.m. on Monday, September the 1st in Pavilion 3C. Check out more about Brad and Lucas at the website TorieRobinson.com, and you can access this podcast, the video, and the transcription of the entire episode all in one place, and links to the Congress as well. And if you haven't done so already, please press the thumbs up for this episode, comment below, and subscribe to our channel so that we can get way more people around the world, clinicians, patients, and the general public, learning facts about the epilepsies. See you next week.